Hello, hello, hello. Let me get over to my document. Okay, so this is my report on Morocco's nutrition situation. Here's a little picture. Morocco's right next to the Atlantic Ocean. And I thought this was really cool. This website actually is amazing. You should go to it if you ever want to visit Morocco or anywhere else. They have extensive knowledge. All right, so, my report provides an analysis of the nutrition situation in Morocco. I picked Morocco because my ex boyfriend's Moroccan and he just dropped knowledge bombs on me because I am a white American and I really don't know any Moroccan culture at all. So, I wanted to dive into the nutrition side of it. Um, so, the nutrition situation in Morocco, focusing on prevalence of the malnutrition, micronutrient deficiencies, overweight and obesity issues, and dietary patterns. I evaluate the effectiveness of existing policies, programs, and purposes or proposes evidence based interventions to address identified nutrition challenges. So, Morocco is a middle income country in North Africa. I thought it was low income, so that was interesting to me. Well, and they've made significant strides in economic development and public health, hence the middle income. It still faces substantial nutrition related challenges, though. As part of the global south, Morocco's economic constraints, historical legacy, and infrastructure issues contribute to its complex nutrition landscape. This report is aimed at a detailed analysis of Morocco's nutrition situation. I want to identify determinants of malnutrition and recommendations for the population for nutrition improvement. The status currently, and I got these off the UNICEF and the WHO and the FAO websites and studies from them. Stunting is 5.1% of children under 5 as of 2023. Wasting, 2.3% of children under 5 as of 2023. Underweight children, there's a 3.1% that are under 5 that are underweight. Micronutrient issues, deficiencies. There's a bunch of anemia among women, a lot who are pregnant, 37%, and children, 32%, as of 2022. The overweight and obesity issue, as of 2022, by the FAO, is a 20.6% of adults are obese. That's a lot. Exclusive breastfeeding rates, 27.8% of infants under 6 months. That this means that either women who are breastfeeding are not able to breastfeed, or if they are breastfeeding, the infant is not getting enough nutrients. Dietary patterns, low consumption of fruits and vegetables overall, and high intake of sugary and fatty foods, which we have issues with that here in the United States as well. The determinants of the malnutrition. So, a big factor is poverty. There's high poverty rates in rural areas because they just have limited access to good foods that are nutrient dense, at least. Um, Healthcare access, they do not have a lot of healthcare facilities in Morocco. They have a few in the big cities, but other than that, the outskirts, they don't have anything. So, unable to get access, they would have to ask maybe a member of their society who might have doctoral like standing, but not necessarily a doctor. Um, Sociocultural practices, traditionally dietary practices, and limited awareness of nutritional needs. So that goes into the education. If there's low levels of education, especially among women, breastfeeding, it impacts their knowledge related to nutrition of themselves, their babies, so on and so on. Infrastructure issues, especially in rural areas, it affects the availability of fresh produce and limits nutrition education, says the World Bank as of 2023. Colonialism, so economic exploitation and disruption of traditional agricultural practices during colonialism, have long-lasting effects in local food systems and use. I would keep in mind that Morocco is under some existential stress right now, so this would right now be a really big factor. So, existing policies and programs that I found, Morocco has several policies and programs aimed at improving nutrition. One of them is called the National Nutrition Strategy, and that focuses on reducing malnutrition and improving food security. Food security is the opposite of food insecurity, so promoting access to food. They also have school feeding programs, which is great. Feed those kiddos. Micronutrient supplementation. Anemia is a big one just because of the micronutrient issues among especially women and children. And then this one I found as to be a big factor as well. So gaps in implementation. So resource allocation, insufficient funding and resources allocated to nutrition programs. So I'm not really 100% familiar with how the political standing is in Morocco, but it's very different from ours, and not a lot of resources are put towards nutrition specifically. The monitoring and evaluation of nutrition, there's not a lot of programs, and if there are programs, they have found to not be very successful. And then community engagement. So limited involvement of local communities in program design and implementation. I found this to be interesting because the culture over there isn't very like outgoing to outsiders, so they're going to keep close knit with their communities. And if you're trying to implement new programs, policies, education, they're going to be very offstandish with those people. So I proposed some interventions and solutions of my own ideas. Healthcare interventions. So obviously improve access to healthcare services, which would mean maybe more like of a mobile clinic, or even online or through the phone if they have access to that. Maybe even putting more money towards building hospitals or structures like clinics closer to these rural areas. Um, Strengthening maternal and child health services. Because the rate of women and children that are malnutrition are so much higher than anyone else, that's what they need to focus on, because mothers need to be able to eat and drink the foods that they need to produce their human child, and then after that to produce the milk for their child. And getting more education and knowledge about how nutrition really affects us, especially at a younger age, throughout our whole life. It would be very beneficial for them in the healthcare sense. Agriculture and food security, promoting nutrient sensitive agriculture practices to enhance the availability and affordability of nutritious foods. So they have a lot of mass produced foods that are actually sent to the US, but maybe promoting these nutrition sensitive practices will help produce better foods for their own communities. Um, supporting the smaller farmers with resources and training to diversify their crops would improve food security. Education and behavior change, that's a huge one. I also need help with that in some areas. Just giving these people, especially in rural areas, mothers and children specifically, just the knowledge on behavior around nutrition and culture, especially in that, right, the first 1,000 days of a child's life. Like, a lot of these women don't understand these concepts, and providing that education would integrate nutrition education into schools and promote healthier habits. The multi-sectoral collaboration, that's more on the political side. So collaborating between government, NGOs, and private sectors to address the nutrition challenges, and then engaging the local communities in the planning and implementation of nutrition programs to ensure cultural relevance and sustainability. Honestly, I think that this is one of the most important factors, because political standing, policies, government, that's at the base of all nutrition related issues. I know that here in the United States, it's a huge factor. So cultural sensitivity and capacity building. If we understand, right, as dietitians, Moroccan food practices, or just any other culture, if you're going into their communities, we need to understand their culture, especially around building trust, their communities, how they eat, when they eat, like what they eat. We need to know all of these things so we can address the needs and give them the available resources in order to create that knowledge, education, and then action of using these practices.